Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. We've got another great tip by Mark Wood, our nutritional expert. Last time he gave us a tip, we talked about the glycemic index, and one thing we didn't cover is that leads to a big release of insulin, and high insulin levels leads to aging. It's a long story, which we'll talk about some other time, but this time we've got another nutritional tip. Take it away.
Thank you very much, Doctor. This time I'd like to talk about inflammation. And the reason is because inflammation is really rampant in our society today, especially silent chronic inflammation. Obviously, we're supposed to, if we injure ourselves, have an inflammatory response, protect that area, move in the immune system. But then when it's taken care of, that inflammation should turn back off.
Right.
And what tends to happen is with our diets today, and particularly the amount of omega-6 fatty acids, because those actually are the molecule that trigger the pathway for the inflammatory response. Omega-3 is what turns it off. In a natural diet, you have about a 1-to-1 ratio of those two. What's typical in America today, or at least what's not unheard of, is a 30-to-1 ratio of 6s to 3s. And so the inflammation is being turned on and it's never being turned back off. So what I usually recommend to people is that to get as many omega-3s as you can. The way to do that is fish is one good way. There's certainly fish oils, cod liver oil. That's my particular favorite because there's a lot of vitamin D in a very natural form that comes with it as well. For those that are vegetarians, flax seed oil works very well as an anti-inflammatory, but it does still in your body have to be changed into the EPA and DHA that are provided with fish and cod liver oil, so it's just an extra step. Those are the omega-3 fatty acids.
Okay.
They're pentanoic and hexanoic acids.
Okay.
So, one thing that you want to be sure is that you're reducing your omega-3s. Your omega-6s.
Right.
We want to increase the omega-3s.
Right.
Omega-6s are primarily in grains, if you overdo grains. They're in chicken that's been grain-fed. They're in beef that's been grain-fed. So you want free-range chicken if you want to reduce inflammation. You want grass-fed beef. And then you want to supplement with plenty of omega-3s. Another way to do that is olive oil. Because although it's a monounsaturated fat and it's not a true omega-3, it fits the same keyhole in the system and works the same way.
Excellent. I've always wanted to know about the balance between omega-6 and 3. So that was very helpful. Thank you.
It certainly has gotten out of proportion these days. And of course, many cancers, much heart disease, even oral infections, things like that, arthritis.
Yeah, chronic
asthma.
Inflammation is clearly linked to increased cardiovascular risk.
Absolutely.
So, okay, thank you so much, Mark.
You're very welcome. Don't fry your foods.
Okay, we'll be right back.